Asian College Foundation Incorporated, and today I will be demonstrating how to don or apply and remove sterile gloves. Sterile gloves are usually used to prevent contamination, and it helps control infection. By following the procedures on how to don or apply sterile gloves, we are able to prevent the spread of microorganisms or infection, as well as we can prevent the risk of cross-contamination. So the first thing to do is perform hand hygiene or proper hand washing to keep our hands clean and prevent the spread of microorganisms. Now we must check the pack of sterile gloves. We must make sure that the package is dry, unopened, as well as the date is still valid. So, this step is important since moisture can contaminate the sterile product, and expiry date would mean that the gloves are not sterile anymore. Next, we must place the sterile glove package onto a clean, dry, or surface above our waist. As mentioned, moisture can contaminate the sterile product or gloves, and any sterile object below the waist is considered contaminated. We will now open the inner package through the top flap, then the bottom side. Remember to not touch the inner surface of the package or the gloves. Then, we're going to throw this into our trash can for avoid contamination. Use the 1-inch border of the inner package to open the inner package carefully. Always insert your sterile gloves into your dominant hand or your right hand. Use the thumb and forefinger of your non-dominant hand to grasp the folded cup of the gloves for your dominant hand. Only touch the exposed inside of the gloves to prevent contaminating the glove. Keep your hand above your waistline and lift the glove off the inner package with fingers down. Do not touch any unsterile objects to prevent it from contaminating. Then, we're going to touch the folded cuff of the glove. Then we're going to insert our dominant hand. And we're going to pull the glove. And pull the glove. Remember to leave the cuff folded until the opposite hand is gloved to prevent contamination. Place the finger of your gloved hand inside the cuff of the remaining glove. Lift it from wrapper and do not touch anything with the gloves. And again, carefully insert your non-dominant hand into your glove. Pull the glove and make sure it doesn't touch anything unsterile. Slide the finger of one hand under the cuff of the... And we're going to adjust gloves on both hands if necessary only, and just touch the unsterile area only. Adjust the gloves both hands if necessary only. After both of my hands gloved, I'm going to clasp my hands in front of my body and hold it away from the body. This is done to avoid accidental touching of non-sterile objects in the front of my uniform. Now that we are done with donning or applying the sterile gloves, Let's pretend that these gloves are now soiled and we have to remove them. So, to remove the gloves, we will use our dominant hand in grasping the opposite gloves near the cuff and the outside of the exposed area. We will remove it by pulling downward, allowing it to be inverted to keep the contaminated part inside. We will hold the removed glove in the remaining glove hand that prevent contaminating our hands or twist. With the use of your two fingers, we will slide it between remaining glove and wrist of our glove's hand, just like earlier. We will remove it by pulling it downward so that it will turn inside out and prevent contamination. Make sure that the left hand completely enclosed the other glove and keep the contaminated area inside and secure the glove inside the second. Now we're going to discard in the appropriate container to reduce risk of transferring infections and contaminating other items. So now you know how to don and remove the sterile gloves. Remember not to touch anything nor scratch your nose or face when it's itchy and you have gloves on to prevent contamination. Then after removing your gloves, we're now going to hand wash again. That's all. Thank you.